Medication side effects, part 3. Today we're going to discuss a little bit about mood stabilizers, and we've already discussed antidepressants and antipsychotics, and I know frequently antipsychotics are used as mood stabilizers, but we're going to talk about a separate class, mainly Lamictal, Depakote, and lithium. Individually, Lamictal, also known as lamotrigine, is frequently used as a mood stabilizer in folks who have especially bipolar depression. Actively, it's not great to get someone out of a depression, but once a person is stabilized, it can put a basement on how low their depression can go. In terms of what needs to be monitored, you want to make sure that your white blood cells are monitored at least every 6 months, because it can cause you to have a decreased ability to fight infection. Of the hairy, scary variety side effects, you want to watch out for Stevens-Johnson syndrome, which is where you can get bullous rash over your skin, especially your hands and face and palms and feet. You want to be aware, though, that a small percentage of folks who take Lamictal can actually get a benign rash, and this can happen especially if you are also allergic to the sulfa drugs like Bactrim. So be aware of that as well. Make sure you let your doctor know if you're allergic to anything. With lithium, it is fantastic to lift a person out of depression. It is fantastic to make sure that a person isn't having the more effusive or effervescent type of mania. And it, strangely enough, is the only thing that we know that can actually decrease suicide risk in patients. It is not a great option for folks who have chronic kidney disease, who have chronic thyroid disease, or people who work outside a lot, because lithium looks a lot like sodium in the kidney tubules. And when you get dehydrated or you're working outside or you're sweating a lot, what will happen is that your kidney tubules will actually excrete sodium preferentially, and wherever sodium goes, water follows. And so what happens is that not only are you more dehydrated, so the lithium is more concentrated in your bloodstream, but also your water is leaving you. And with the lithium, there's a very narrow therapeutic range that is safe for you to be within. And if you're outside of those ranges, it can be very dangerous for you. So you have to get your thyroid checked, you have to get your kidneys checked, and you have to get your lithium level checked at least every 3 to 6 months. Talk to your doctor if you have any other questions. So for Depakote or valproic acid, it's great for the more agitated, irritable type of mania that we see in bipolar folks. It is quite useful in sort of bringing people down to earth, especially if there's a lot of aggression involved. It is not good for our folks who have comorbid alcohol abuse issues, fatty livers, or using any other medications that are really hard on the liver, like acetaminophen or Tylenol. So if you have multiple back injuries or you've had multiple surgeries and you're using things like oxycodone, for instance, it's not a great option because those two things would be way too hard on your liver. Much like the lithium, you also need to make sure that you get levels drawn and check to see that it's not making any of your other numbers misbehave as well. So for all 3 of these medications, it's really important to talk to your physician or prescriber if you get a rash, if your mood gets worse instead of better, if you become actively suicidal, or if you are hallucinating or feel like you can't keep yourself safe, get yourself to a hospital immediately.